As coronavirus cases surged to a record high in the Commonwealth after the holiday season and the CDC guidelines on isolation and quarantine changed, some parents in Needham grow perplexed as to whether they should keep their COVID-19 exposed children from school and for how long. Others started to question the testing approach the district takes, asking the school administration to participate in the routine pooled testing. At the school committee meeting on Tuesday, January 4th, the administration explained how the new guidance applies and the rationale behind its test and stay protocol.
When school started after the holiday break, some parents were told to keep their COVID-19 exposed children home. Among them were fully vaccinated children who received their second doses more than 6 months ago. Needham parent Ceci Fleming said children should not be punished for getting their vaccines as early as possible.
If this is what you intended, I would like to hear you as a group discuss why you are penalizing children who immediately went out and got vaccinated.
Brown Meadow parent Melissa Bello said the district's policy contradicted the new guidelines from the Department of Elementary and Secondary Education.
The Massachusetts Department of Elementary and Secondary Education issued guidance on December 30th or 31st that districts should not be doing it. And again, I want to echo Ceci's comments that we actively kept children out of school despite the pleas from people across this country to get kids in school. And that is the most important thing for their mental health right now.
The confusing messaging stems from the fact that, while the updated guidelines from the Department of Elementary and Secondary Education exempt asymptomatic, fully vaccinated close contacts from quarantine, the Department of Public Health website still calls for a 5-day quarantine for close contacts who received their second doses more than 6 months ago and have not received a booster shot. Assistant Superintendent for Student Support Services, Mary Lemmy explained the district followed different protocols between in-school and out-of-school exposures.
For out-of-school exposure, and the important point here is these are requirements that we follow under public health, the Department of Public Health. So our Board of Health is following DPH, and we are following what our Board of Health are directing us to do.
Students exposed to coronavirus outside of school do not need to quarantine if they received a booster shot or were fully vaccinated within the last 6 months. Unvaccinated or fully vaccinated over 6 months without a booster shot need to quarantine for 5 days. If students were exposed in school, then they can attend class if they are fully vaccinated. Unvaccinated students are also able to attend school through the Test and Stay program as long as they test negative for 5 days. In light of the spike of Omicron across the nation, some parents urge the district to use a more proactive testing method, like the weekly pool testing, also being referred to as surveillance testing. When school began last September, the district opted out of the state-sponsored pool testing program because of the high vaccination rate and low transmission rate in school. The administration was also concerned any false positive results would cause unnecessary disruptions in student learning.
In light of the new variant, which is evading vaccines, so that kind of takes away the high vaccination reasoning, as well as the fact that it's much more transmissible. I'm interested what the reasoning now would be to not be using this testing.
Superintendent Dan Goodicon said even though the state pays for pool testing and supplies, it still takes a big toll on the district's human resources. But he also said things can be subject to change any time.
The state's program was implemented in the summer when staffing was a little easier to figure out, a little bit easier. Maybe not much. It's become increasingly more difficult to find staff. Even for our Test and Stay program, we are not completely fully staffed. To go into surveillance testing now would require more staff. Additionally, it's going to be an impingement on student time and classroom time. Our focus is to keep kids in the classroom learning, and pulling them out for pool testing pulls away from that classroom instruction. Nonetheless, we're not looking at any one thing. We're trying to figure out in this time, where do we want to put our resources? What's the best bang for our buck that will be healthy and safe for our kids? I think we have it right, But we're going into this eyes wide open, and we're going to continue to decide and discuss what makes sense now that we're in this kind of a new phase of the pandemic. And is surveillance testing something that we want, an endeavor we want to float?
From December 30th to January 5th, 57 Needham students and school staff tested positive for COVID-19. As of December 31st, the positivity rate for the town of Needham is 5.35%, compared to the state average of 20.06%. To learn more about the school requirements for isolation and quarantine, go to the district's website and click COVID-19 Health and Safety. For the Needham Channel News, I'm Yu Xiaoyuan.